Jimmy, knock it off. There's people walking around outside and the bird is going nuts. So, good morning, everybody. This won't be that long of a stream. Oh. I am really glad I had my port done on my left side. Jimmy, stop it. Honestly, he'd probably be quieter if I went open to the window, but I'll give everybody a chance to come in. Goodness gracious, guys, it's been crazy. So, surgery for my port went really well. I think I did a video about that. Surgery for my port went really, really well. I am in a lot of pain today from that. Jimmy, honey, I'm not able to take ibuprofen, so the only way to get the swelling down is lots of ice. I may break down and take ibuprofen later, but it can cause reactions, so I've been trying to avoid that. But yeah, surgery went well. I'm exhausted right now because the dog woke me up and I didn't sleep real well. But yesterday was bone marrow biopsy. I was really nervous about it. It actually went really well. Hey, Ricky. Thank you. But port surgery went really, really well. It's over here, right under here. Ta-da! It is farther in and lower down than it was on the other side. The other side was way over there, which I'm thankful for, because when they're in those armpit areas, they're really positional. And thankfully, this one's a little bit further in, which means my arm is not as sore as it was with this one. However, my boob is killing me. Holy shit, does the boob hurt. I am not a person to wear a bra most of the time. And I only own a sports bra. But I legit, if I don't have that on... Mind you guys, I have massive boobs. I have huge boobs. We are hoping to get a reduction before too long, if we can. But my boobs each weigh at least 10 pounds a piece, I would say. Maybe not 10, but close to that. So a boob pulling down on the neck and everything hurts a lot. So sports bra. Jimmy! Shh. I'm gonna have to cover that bird when I get up. So yeah, my neck is really sore. It always is, because that's where a lot of the manipulation happens. Because they put the port in and they thread the catheter through the vein. So my neck gets really sore because that's where the most manipulation is. The incision on my neck is much smaller. You can see right here. This is where it is. I definitely have some swelling going on. My port's best friend right now is ice packs. Sadly, I only know where one is. But I will fix that later once somebody comes home. But bone marrow biopsy. We went out to Kansas City Hospital for that one, KU Med. And God, the staff were wonderful. They treated me so well. They listened to me about the mast cell stuff, because I told them, you know, with the mast cell, I tend to get really, really, really itchy with these types of medications. And they're like, oh, that's no problem. Well, we'll throw that Benadryl right on there. We'll give you the Benadryl and Versed. Then we'll take you in and give you some x-rays and go from there. And I have to say, while I was awake in the waiting room, or the OR, for a little while, well, it's not exactly an OR, but kind of, that while they did the x-rays, they had me positioned, they cleaned the area, all that stuff. And I was awake for part of the numbing, which was not fun. But I'm okay. They started putting me to sleep when they were doing the numbing. Holy shit, you guys. Wow. So, interesting fact is ketamine is actually really good for those with mast cell. It kind of resets the system a little bit. And I'm sorry, I'm talking weird. This, it's numb. Just this spot. Literally, there's like a fingertip size spot on my tongue that is numb. And the bottom underneath is sore. I'm not sure whether the catheter is sitting on the nerve or if they somehow just the breathing tube from my surgery rested on this. It's been like that since my surgery. It's okay though. But yesterday they used a combination of like 4 different drugs to get me to put me to sleep instead of using propofol, which would cause the need for a breathing tube and stuff. Hang on, I got a scratch itch. Jimmy, buddy, I know. Knock it off, honey. They used Versed, Benadryl, fentanyl, and ketamine. Ketamine I have had a few times before. That shit is nuts. Like, absolutely nuts. Just, I had the worst case of deja vu as I was waking up. Like, I literally felt like I had said this exact things before. Mind you, it was not. But I also could tell I was responding to them, but I couldn't tell that I was moving my mouth. It was funny. Ketamine is some strange stuff, but it works pretty well. Yeah, so anyway. Ouch. My bone marrow biopsy, it is under the diaper. So it's Jimmy, stop it. I'm home alone with all the pets today because Hannah had school and Andrew had work. I'm hoping Andrew will be able to have a half a day. Depends on if his coworker was still sick or not. Not COVID. But, as far as the bone marrow biopsy goes, that pain is not too horrible. It's pretty sore, but it's not like a ton of pain. Not like this. Also, yesterday, they had done the IV in me Tuesday and left it in so that they would have it for tomorrow. When you have a bone marrow biopsy, they have to do, like, blood counts right before to make sure you don't need anything, that you have enough platelets, all that stuff for the bone marrow. So they were trying to get blood. They tried it from the IV, but because the IV was more than 24 hours old, it did not want to give it to them, which was fine. I'm like, just go ahead and poke me wherever. They did 1, 2, 3, like 4 attempts. Three attempts at blood work with just a needle before they said, okay, it's time to get the ultrasound to find a vein. And then they decided, seeing as we are using the ultrasound and we're poking you, why aren't we just putting another IV in? Because they were like, that one's this one worked. Like, I was worried the one they left in wouldn't work at all. It did work, but I know that the last dose of meds they gave me, in the recovery room, definitely infiltrated. So that side is really sore, but they used the one in this arm. The big bruise right there is not from the IV. The IV was in the crook of the elbow. So they used that IV for the meds because it was more reliable, and they got a nice, gorgeous 18 gauge needle in that vein, and they did it almost really not much pain at all. She was really good. But yeah, I didn't remember a thing. I'm so thankful I didn't. I was really worried about how far they were going to put me under, like, because they say conscious sedation, and that could mean from anywhere from you still kind of remember and feel things to you don't, but you aren't under enough that you typically need a breathing tube. So I didn't feel a thing. I didn't remember a thing. Well, I remember before and after the meds, but it went just so smoothly. And I have to say, I have had just the best experience with nurses in the last couple of days. Like, both surgery places were amazing. Yesterday, when we got to the hospital, it was a shit show. So, patient drop off was backed up. We thought we were going to be late because of it. It turned out they had actually changed my timing by 25 minutes, so we were perfect. So I get dropped off at the door, and Hannah goes to park, and I go in, get my temperature checked and everything, and I was going to go sit down. I'm like, you know what? I went to the lady and asked her if she could grab me a wheelchair, because the only wheelchairs they have, I cannot operate myself. It's those, they're newer, and I can't push myself around at all in them. But I asked her for a wheelchair, and this wonderful doctor that was on his lunch break overheard me asking her for a wheelchair. And he came up to me and asked me if I would like to sit down while I waited for the wheelchair. So he pulled one of the chairs out, like probably a good 10, 15 feet from where it was for me to sit. And he asked me, he's like, "Are you lightheaded or anything? Like, are you okay?" And I said, I'm totally okay. I'm in a lot of pain because I had surgery yesterday, and I have a hip that dislocates, so I can't really walk well. I sat down in the chair, and the doctor he was on lunch break, stood there with me till the lady came back with the wheelchair and helped me get in the wheelchair. And then he stayed for a couple of more minutes, and a couple of different people were asking me, do you need help getting to you where you need to be? And I'm like, no, my person's coming in. She just had to park. But he stayed with me for a couple of minutes just so that, just to make sure. And that was so sweet. And this is the kind of service that I really do love, you know. And I bitch about my couple of doctors at the ER semi often, but there's really only two doctors I've ever had a problem with. And KU Med is just as wonderful as our local hospital, and I couldn't be more appreciative and thankful the to the nurses and everything that I've dealt with. Had a wonderful goofy nurse yesterday. He was a sweetheart and just so gentle and kind. All of them were so kind. They felt horrible because they had to poke me again, and they're like, "Oh my God, you poor you're like a pincushion. Like, this is so sad. I hate doing this to you." And I'm like, "Look, I'm used to it." But all of them are like, "Yeah, you really did need a port." I'm like, "Yeah, I really did." So it was, all in all, it was a really good experience. I am exhausted because I have had no sleep for 2 days. I slept some last night, not real great. Jimmy, honey, Jimmy, it's okay. He really wants to be in here with me. I can't push his cage back in here. We put him by the window the other day because he was so excited about the window. And now he wants to be where he can see me because he can hear me, but he can't see me. I know, baby boy. I know. Currently, I have a dog at my feet. The dog will not leave my side. Um, Simon has been in and out. Simon's not feeling so hot, by the way. He's got either an eye infection or really. Jimmy, honey. Pardon my yelling. Jimmy! Calm down. If I stop talking, he'll stop talking. But, yeah, Simon's not feeling too hot. I had to snatch him last night and give him a dose of liquid Benadryl. He hated it. He foamed at the mouth and everything. It was much less traumatic than shoving the pill down his throat. We're really struggling to get him to take any allergy medicine. So that's fun, but he needs it. He was supposed to have an appointment with the vet yesterday. I think we might have to reschedule. I did reschedule it. Where did I put my? I did reschedule it because we didn't have time for that yesterday. So his eye is swelled and runny and stuff, and he's sneezing a bit. But we'll take him in here soon. Jimmy, baby, Mama needs you to be quiet. But so Mustard is definitely could be trained. easily to be a seizure detection dog, a diabetic alert dog, all that. He can sense when. Jimmy! There's people back there. Okay, we're gonna get up and go open the window and partially cover him or something. I need to put this back anyway. Oh, but it feels so good. My ice pack is my best friend right now. So I'm all itchy on my back. Wait, what did that say? I know how scary it can be. My dog had vestibular ataxia earlier this year, and I was panicking. Ah, yeah. Like Leo, Simon's doing okay. He freaked me the fuck out the other day though, because as if you guys know, Snitch passed away from lung cancer, and the day before he passed, his breathing and his coughing was so weird. And a couple days ago, which is why we set up the appointment for Simon. A couple days ago, Simon was making those same noises, and it scared the living shit out of me. We think he just has allergies, from what we can tell, because if we give him the Benadryl, he definitely calms down. Part of the problem is he is such a picky little cat. He's very picky about foods and treats. Like, treats have to be a certain type of a certain size, or he won't eat it. I even gave him a ton of treats last night. Wouldn't eat it. I mixed liquid Benadryl into like this smelly tuna pate, super smooth pate soft food. He wouldn't eat it. So last night we resorted to, I gave him a milligram or a milliliter of IV Benadryl. He can have 2.5, but I gave him I gave him like half of a cat dose of Benadryl, and he's such a dramatic little shit. It's so funny. Like, it is absolutely hilarity. Hi, baby. I don't think his eye is infected so much as he may have scratched it. You coming to see Mama? Jump, jump. Hi, sweet boy. He has been by my side since the surgery as well. He's been very concerned. I'll see if I can show you guys the dog right now. Pardon my messy house. Literally, he's right there. When I try to get up, he sits in front of me like he doesn't want me to get up or anything. And there's my Sai-Sai's butt. Hello, Sai-Sai. What are you doing, dude? Simon. Kitty, kitty. Jimmy. Oh, yeah, I was getting up to go open his window and put my ice pack away. I have to empty my lap before I do that. So, yeah, right now I have here's my, that bruise right there. That's where the IV was. And mind you guys, when he put it in, because it was the guy there's the typical nurses that put them in, and then there's the IV therapy nurses. They have special needles, they have ultrasound, they have lidocaine, all that stuff. And so he was the one that suggested to my surgeon that we leave the IV in so I didn't have to get poked. It didn't work out that way either way, but anyway. It did work until we got there pretty much though. So, but the last dose, my pre-op and post-op nurse didn't know they didn't tell him they got an IV in him. He was trying to get blood. He switched with somebody because one of his patients needed him. And so he switched with them. So he had no clue when I came out and needed pain meds that I had a second IV that was working great. So he put it in that IV. And it did infiltrate a bit. So my arm is super sore. Like, the bicep itself is really sore. So that arm is not very movable. But that's okay. It'll go away. Sorry, I'm trying to attempt to get up, but there's a dog in the way. May 5th, our puppy is having surgery, guys. Well, he's not really much of a puppy. He's a year. He's 13 months. Okay, here we go. Whoa, oh. Ow! Yeah, I can't stretch that bicep out all the way. Okay. And the dog doesn't move. Partially, I think, because he knows I'm trying to get up, but he's laying on all my clothes. Hi, baby. Here's Simon. This is his boo-boo eye right there. He is so sweet, though. He loves his mama so very much. Where is your brother? There's not a Leo around. But I'm sadly, with all this, the biggest problem I have is changing my diaper. Oh, he dragged. They're freaked out because Mustard does this thing where he drags Hannah's clothes downstairs when she's like in the shower or not home. So he's in there. Good. Would you like me to open your window, baby? Hello. Do you just need to say hi to Mama? Huh? Did you just need your Mama? Hello, sweet baby boy. Here. Here's my Jimmy. Hi. You have everything. Except for maybe water. You're gonna need water today. Hey. Shh. Hey, it's okay. Hi. I'll probably have to give him a treat to calm him down, too. First, we're going to try his towel. There you go. All right. My kitchen is an absolute wreck. Yes, Mustard, I'm here. But yes, Mustard is having surgery on the 5th. He has a very rare thing for big dogs. Leo, get down. Leo, no. Leave Mustard, not Mustard. No, that's not your food. But he has a luxating patella, which is very, very common in small dogs. It's not so common in big dogs. But it's really bad. It's a grade 4. Because it literally doesn't stay in place. So he's going to have surgery on that on the 5th. Here he comes back over here because I sat down. No, we're not going upstairs. Come on. Hello. There's Leo. There's my Leo. Yeah, I know. I need a diaper change. He's like sniffing my diaper like, yeah, you need a change. Yeah, I do. And down he goes. Hi, baby. Hi. They're all very protective of their mama. It's really interesting because Mustard is not like super interactive with me most days. Because Hannah's home and he adores Hannah. He's Hannah's dog. And the days she's gone or asleep or something like that, if she goes to take a shower or anything like that, he is like by my side. And he knows when I am not doing well. Because even when that's happening, when I'm having a really rough day or something, or I'm having a bad POTS day, he'll come sit with me instead of Hannah. Like, he'll just sit in front of me on the couch. And he knows. Sorry that the camera's shaking. I'm freezing because I just had... Oh, fuck, I forgot to take my ice pack back in there. Where is that? But yeah, I'm freezing. B, my tremors are bad. But yeah, so... Oh. It's natural for dogs to sniff crotches anyway. Um, it's an extremely normal thing. Um, but he's so cute. Let me do it again. Hang on. There it is. Look at this. He's got his face buried in my hoodie. You can see by where my foot is. He is right there. My foot is kind of weird today. It's mildly purplish. But he is such a good dog, guys. Our vet told us you hit the lottery with this one. Like, he is so well behaved. He is just chill as can be. Like, he only gets really antsy if he has to poop or go potty, and he's pretty quick to tell you. He'll sit by the door. But this is what he does all day long. Mostly, he is just a chill dog. He will need to run and stuff like that because dogs. But he is so sweet and so gentle, especially with me. When I am in charge of him, and like say if I were to go take him for to go potty right now, he would heel right next to me. He only wants to be within. He won't get more than like 3 feet away from me. And boy, does this dog listen to me, especially when I'm sick. He knows and he listens really, really well. Um, So he is such a precious boy. That's why we're getting this surgery done for him, because a lot of people would be like, well, we have to take him back because we can't afford it. Thankfully, we do have a credit card meant specifically for medical stuff, especially with pets. And we're going to work it out. It will be reimbursed by the pet insurance company. But he is only a year and not even a year and a half yet. He's a year and almost 2 months. And we're like, he has his whole life ahead of him. So of course we're gonna get his surgery, because with that fixed, this dog is gonna be just wonderful, wonderful, wonderful dog. He has very much so enriched our lives. Um, so we're very happy with him. Mind you, once we own a house or are out of apartments, we will be doing more than one dog, because eventually we would like me to have a service dog. Ooh, you can see the bruising going on. I'm not allowed to shower till tonight. I'm not allowed to take my bandage off till tonight either on my butt. So hopefully I can do that. Because I can't take a bath at all, which would feel so good right now, but I can't take a bath for a week. I can shower and get the bone marrow site wet, but I can't soak it. And we're going to do everything in our power with my port as well, because as you guys know, we had such a problem with it last time. We are going to be covering it whenever I shower, because we need to keep this glue on as long as possible. But it itches. I'm going to take some Benadryl here because I can feel the itch from the pain meds. The annoying thing about Percocet and me, guys, like Percocet's never worked real well for me, but they love to use it. I do much better with hydrocodone or morphine, which they don't typically send you home with morphine. But Percocet does a really good job at making me loopy as all get out, but it doesn't do much for pain relief. It has to build up, and I don't have enough meds for that, so. But I'm trying to take it 2, maybe 3 times a day, and they only gave me 10 pills for it, so, which sucks. If worse comes to worse, I will go to the ER and be like, look, I can't keep the pain level under control, but I will call my surgeon before that and let him know. But yeah, so, okay. I was really hoping I could paint today, but I think I just have to rest. I don't have range of motion well in my left side, so pardon me. I itch because my back itches because they put all the heart monitors on my back. Because with a bone marrow biopsy, they lay you on your stomach. So they were all on my back, and I react to the heart monitors pretty decently. So it's gonna be pretty itchy. Plus, I'm an itchy person as it is. But you can kind of see I'm getting a little bit red and stuff, which means it is Benadryl time. My best friend. Normally, I would use a cup for it. I don't have one handy, but I know kind of dosing-wise how much to drink. Don't do this at home. I let it do about 3 glugs, and that's about 75 milligrams. It's really funny because yesterday, people are like, well, we don't want to give you that much Benadryl. That's a lot of Benadryl. Like, you guys realize I live my life in an allergic reaction. Like, you can see it up here. Around my eyes, my lips are getting weird. I'm like, you don't realize that I have a huge abundance of histamines in my body. My mast cells go nuts. It takes a big dose. Usually 50 is a perfect dose for me as far as IV Benadryl goes. But it's just kind of funny when they're like, whoa, you take that much Benadryl? Uh-huh. Yes, I do. Because that's the only way to get my mast cells to chill. Jimmy! Stop! Okay. I have reached the cover the bird phase. Thankfully, he enjoys his covers. This has been his blanket for the last 10 years. This is his blankie. And you'll see he absolutely adores his blanket. I know you want to get out so bad. Do you need a little bit of kisses? The problem with getting him out right now is he flies. Oh shit, your thing is on top. This is far more than 10 pounds. But I don't have much of a choice at the moment. I'll just use my right hand. That should calm him down. I'm right here, Mustard, yes. Should I eat or should I not eat? Okay. That should help calm him. Jimmy, shh. Okay, you know what I'm also going to do? Yeah, I figured you'd do that. I think I'm going to move him where he can see me. Watch out, Leo. Move, Leo. Leo! My body blows through them like mad. That's the problem. What did it say? Yeah, my body blows through. Watch out. Mustard, no. Back. Back up. Is his spot open? No, it's not. But this spot is. So we're going to put him in this spot. We've been keeping him right by the washer and dryer right here. Because that's where we were able to block the dog out of. Sorry, I'm scratching my boob. My body blows through medication. Like, my butt should have been numb for several hours. It was pretty much... Hang on, I gotta check something. I gotta check something real quick. Okay, it's upstairs. Checking out the face. Just making sure. But, because of the mast cell and possible EDS, my body blows through the pain medications very quickly. Especially things like lidocaine. Leo. Levi is my cousin's name. Leo, No. Mustard, back up. Come on. Back. Good boy, good boy. Yes. Leo, you little devil. Okay. All done, buddy. You do not get your brother's food. But, you can stand over here. But you do not get the food. Let's see if there's enough ice. The problem with bone marrow biopsy, I cannot see my wound at all. So I cannot check on it to see if there's blood and stuff. But ow. Go chill with your brother, Leo. He's in the sewing room. Anyway, guys, I'm going to go ahead and go. Because it's hurting. And I already did a Facebook Live, too, so I was, like, updating everybody. Mustard, leave it. Leo, stop taunting him. Mustard, leave it. I don't mind so much if he chases Leo. Because Leo is a dick right at him. Like, this cat will literally walk up to him, sniff, and then whack him. So he is... It's really funny. Poor Mustard just wants to play with the kitties, but kitties don't understand how to play like a dog. So... Simon, though, is just... Simon doesn't like him near him. Thank you so much. Simon does not like Mustard near him so much, like, you know, but his reaction is arch, hiss, and then go away. Leo, and Simon stands his ground until Mustard backs up. Leo, on the other hand, is such a drama king. He jumps into his chair and he growls and he hisses and he swats and which then makes the dog bark at him because the dog thinks he's playing. And they just don't understand each other. It's funny. Mind you, it's only been 2.5 weeks that we've had him here. So the fact that the cats are doing as well as they are with him is amazing. So, but anyway, I am going to go take a rest. Maybe the animals will calm down enough to let me nap. We shall see. But yeah, I'm a bit exhausted. Oh, but I am going to be getting a new couch here soon. So we had a sectional and we took half of it and threw it away. We kept my half. We plan on at some point. Now I'm being asked to pet the Leo. Hi, kitty. Yeah, hi. He is such a cute little guy. He is such a little shit, but he's adorable. He's rolling all over his chair looking at me with those big eyes. So he's like, I want to be pet. Hang on, I got to find my back scratcher. This one might have to do. I don't like this back scratcher. But I have to. I don't know where my metal one went. Okay, do you guys like your back like scratched or do you like it gently tickled? I am like, drag your nails through my flesh. It itches so bad. And they're all like, oh. And I'm like, no, scratch. Like, scratch my back. And they're afraid. They're like, I don't want to rip your flesh. I'm like, I don't care. I have muscle, dude. It itches like hell. Just scratch. And it's funny. But, yeah, you can start to see some swelling. I am definitely a little bit reactive. So, fingers crossed that I don't require any hospitalization. Not hospital. I don't require ER for any reaction anytime soon because I'm done with hospitals for a few days. Yeah, I don't. Well, okay. Tailbone is literally like at your asshole. I've broken that many times actually. But my biggest problem is literally like right on the side, just like kind of here, like in the back, like kind of where your bra rests, but it's not quite there. It's annoying as fuck. And the annoying part about me right now is to support the port, I have to wear a bra. When I wear a bra, my boobs react to each other. So it's like anytime they touch each other, anytime we touch each other, it starts reacting. So I have to like put paper towels and be. I'm stuck. There we go. I have to put like paper towels in between them to keep them from reacting so much. Oh, this is just so bad. Also, this bra is dead. That's one reason it itches so much. I washed it recently. So okay, I'm gonna go rest because the itching is getting really bad. And the loopiness is kicking in. So I'm gonna go take a rest, and I will see you all hopefully in the next couple of days. Bye, guys.